Hi, this is my video for my IV start. I'm showing my surroundings. Oh crap, my computer's closing. Don't mind that. Okay. I'm going to attempt to show all my supplies. I have my patient. This is a blank towel. I have gloves. I have my 20 gauge needle, and then my supplies here. For the sake of this video, it is opened, but in real life I would not use something that's opened. None of my I have my tourniquet, my bag, my gloves, and then I'm gonna just pretend this is hand sanitizer, which might be irrelevant, but oh, and I have a pen for labeling my tourniquet. Not my tourniquet, but my dressing. Okay. I'm starting my video. Hi, my name is Danielle. I'm going to be your student nurse today. I'm going to provide privacy and perform hand hygiene. Can you tell me your name and date of birth? And do you have any allergies? Alright, so looking at provider's orders, it looks like the provider has ordered IV fluids, and that requires me to start an IV. Is that okay? Are you in a comfortable position? Perfect. I am placing the client's arm in a dependent position with a linen saver underneath. Gathering my supplies, I have a 22 gauge needle, which is appropriate for administering fluids, IV fluids. I have my sterile saline flush, my IV kit, which includes my tourniquet, my dressing, my tape, my IV J-lube, and my tape. So first I've gathered all my supplies, and I've ensured that my equipment is not expired. For the sake of this video, it is open, but we'll just pretend that I just opened it. So first what I'm going to do is I'm going to grab some tape and just kind of prepare my strips. I'm going to sanitize my hands. I'm going to palpate for a vein. Perfect. I'm going to take my tourniquet and I'm going to apply 2 to 4 inches above, making sure not to leave it on for longer than 2 minutes. Perfect. I'm going to take my alcohol swab. It's actually iodine. I'm going to pretend I open it just in case I need it again. So I have my iodine. I'm going to cleanse the area for 30 seconds. Well, okay. I'm going to put on my gloves. And then I'm going to cleanse for 30 seconds. Perfect. Now that 30 seconds has passed, I'm going to prep my J-loop. So I'm going to carefully take off the cap to my syringe and ensure there's no air. And then I'm going to screw on I'm going to attach it to my J-loop, and then ensure there's no air bubbles by flushing. I lost the cap, so the cap to my one end of my J-loop, so we're just going to pretend it's there. Now I'm going to open my IV catheter, 22 gauge, which is appropriate for that for IV fluids, according to provider's orders. Okay, I'm going to reapply my tourniquet 4 to 6 inches above my site. Make sure I do not touch my site as I'm doing it. I'm going to carefully take off the cap. Carefully take off the cap. Carefully take off the cap of my IV. Setting that there. I'm inspecting the bevel, making sure that it's not broken or any way not supposed to be used. So with my bevel up, going in at a 30 to 45 degree angle, I'm going to insert my IV, or I'm going to insert the catheter. Small poke. Now that I've seen flashback, I'm going to level out my catheter and finish inserting. Now that is inserted, I'm going to remove my tourniquet. I'm going to stabilize the catheter and carefully withdraw the needle. And I would put this into the needle sharps box appropriately, and then I'm going to carefully screw on my tip, ensuring it's secured. I'm going to draw back, ensuring I have blood return, and flush with 3 to 5 milliliters of normal saline as prescribed. I'm going to take my Tegaderm and place it on top of where the needle is, ensuring not to cover the hub of the site. I'm going to label it with my name, date, initials, and catheter size, which is 22. I'm then going to take my tape and I'm going to do a chevron to stabilize my IV site, and secure my tubing. And I'm going to clamp this and leave that on for when I connect. I will clean up my mess. Are you in a comfortable position? I would remove the linen saver and dispose of my supplies appropriately and clean up my supplies. And I would is there anything else I can get for you today? No. I've labeled my site and I will document accordingly.